So we went through exercise and like how we get this, the home exercise part. But one of the things that we'll do working in office is developing the shoulder movement. So one of the things that we usually have is some sort of shoulder impingement with this, just especially sometimes not with every movement, but after the shoulder starts to fatigue, we'll start to get this impingement where she can get either the tension through here or even this pinching in the front. So one of our objectives is to get the scapula to be able to move underneath the humerus. So we want to keep, this is sometimes talked about like as the golf ball on the tee, because the way that the humerus sits in the glenoid on the scapula, it needs to be moving around. Like this would be a tee, and this is the golf ball kind of rotating. But we have to be able to create good surface with that. So what we'd work on here is a lot of times this stuff happens in like that between the spine and the shoulder blade, and that's where we'll get that knot there. And so what we want to do is work on freeing that up as we bring the shoulder with it. So we're working on an basically active movement. So we're doing some manual therapy, but also working on getting better range of motion through the shoulder. And this can also go to the neck. So like a really good one of my favorites is coming this across and then bringing your head straight down. Good. Come back up. We got a little too much hair there, sorry. Let's get the hair, get the mane out of the way. And we're gonna bring this across. Good, and then bring the head down. Good. So we have the erector spinae muscles of the spine going up this way, and then we have the rhomboid coming across and the levator scap. So what we're trying to do is basically separate those muscles off so there can be a cleaner pathway for the muscles to kind of go through, and there's not any type of adhesion or scar tissue that's developing between the layers of tissue. And that way you can free up the shoulder and get function back, but also reduce pain through the shoulder and the neck, kind of taking away this tension. So the underlying issue is a little bit more than just a simple, like, is it a muscle or a joint? It's about getting the movement better.